Hi, I hope you were happy with the procedure that was performed for you earlier today. Here are a couple of different points that I wanted to discuss with you in order to help you with a quick recovery. You should keep the gauze in your mouth for about 3 to 4 hours after the surgery is over. You can change the gauze that you have with the gauze that was provided to you in the packet every half an hour to 45 minutes. If you change the gauze too quickly, it can prevent the bleeding from stopping. So make sure that you keep it in there for at least for about half an hour to 45 minutes before you switch it out. If after 3 to 4 hours you still have problems stopping the bleeding, what I would recommend for you to do is to obtain a black tea bag, get a piece of gauze that you have, open it up completely, wrap it around the black tea bag, moisten it, and put it all the way back where you had the surgery. Biting on that for about half an hour to 45 minutes should stop the bleeding. If you still have problems with stopping the bleeding after doing all these things, give me a call at the phone number that was provided to you at the back of your post-op sheet. Also, I wanted to discuss with you the regimen for which you have to use for taking your pain medication. Most likely, you were provided with 600 milligram ibuprofen. I would like you to start taking the ibuprofen as soon as you pick it up from the pharmacy. You should be taking the ibuprofen 600 milligrams, one every 6 hours, for the first 48 hours. In between the 6 hours between the ibuprofen doses, you can take 1 to 2 tablets of 500 milligram Tylenol, which is extra strength Tylenol, in addition to the ibuprofen. But that is only if it's needed. If the pain is completely controlled with the ibuprofen, then so be it. The antibiotics that was given to you, you have to make sure that you follow the instructions that it came with it and make sure you take it for the whole course of the antibiotic that you were asked to. So if it's for 7 days, make sure you take it as instructed all the way until it's all gone for 7 days. You should anticipate having more swelling for the next 2 to 3 days. Usually, the swelling peaks within 48 to 72 hours. Things you can do in order to help it is using an ice pack for the first 24 hours after your surgery, which you're going to use it on and off on both sides. Also, you can start using warm compress after 24 hours. And that would help you with decreasing the swelling, but it will not get rid of it completely. So do anticipate having more swelling for the next 2 to 3 days. For the rest of today, which is the day of your surgery, you should continue having liquid diet. Liquid diet means anything that when you put it in your mouth, it turns into a liquid. So that includes shakes, smoothies, ice cream, jello, and make sure that you avoid using any straws. So you can drink it through the cup, you can have it with a spoon, but definitely avoid using a straw. And you should not be using a straw for at least 7 days after your surgery. The day after your surgery, you can get started with soft diet. That means anything with the consistency of mashed potato. Make sure it does not have any little bits and particles in it, any seeds, anything of that sort. You should avoid having any food that contains those. When you do start the soft diet the day after your surgery, I do want you to start rinsing your mouth with warm salt water or mouth rinse, which is over-the-counter mouth rinse, very gently. And when you do rinse your mouth very gently, do not spit it out forcefully. Just lean over to the sink and let it come out. That will help you keep your mouth clean. The monogic syringe that was provided to you in your postoperative packet, which is a plastic syringe with a curved tip, that is for you to start using it 3 days after your surgery. So, for example, if you had your surgery done on a Monday, you should skip Tuesday and Wednesday, and you will get started using that monogic syringe on a Thursday. So the way you would have to use it is that you will fill it up with warm salt water or mouth rinse. Over-the-counter mouth rinse is okay, and you would use it to clean out the bottom extraction sockets. You can just look in the mirror, see where the extraction socket is. The little curved tip of that syringe goes into the socket and gently rinse out the socket to make sure any food that might have gotten stuck in there will come out. You need to be using this syringe for at least about 3 to 4 weeks after your surgery until the complete healing of the surgical site. Also, the sutures that might have been used for you, they are resorbable. It is going to take about 3 to 5 days for them to come off, and when they get loose, they will come off on their own. You do not need to go back to the office to have them removed. At this point, I'm done with the postoperative instructions. I hope you have a very quick and seamless recovery. If you still have any further questions or concerns, please feel free to contact me at the phone number that was provided to you at the back of your postoperative sheet. And thank you very much for taking the time to watch this video.